Yeah, I'm the worst. Okay. Oh.
All right.
Hi.
So, welcome to weekly Inkblot. God, every single time. Weekly Inkblot. Episode 4. Post-traumatic stress disorder, otherwise known as PTSD. Um, I wanted to start by I'm using by the way, for if anyone is interested, the PTSD workbook. Um, It's around like a little over 20 bucks. Um, I've been using it and actually have learned quite a lot from it. I think it's a pretty good workbook. Um, but the first thing I wanted to do was to begin by talking about what trauma is. Um, because, we hear it all the time. Um, but, do we really realize exactly what trauma is? Um, like Ellie, what would you say trauma is?
Trauma for me would be any terrifying or life-altering event that affects you more than just in that instance. Like, prolonged effects due to a very frightening, jarring experience is probably the most basic I can give.
Okay,
Like, a car accident or going through war or going through abuse. Things that can affect you in the long run.
what do you think, Ash?
Well, I saw a. There's like a movie that was originally a Japanese movie, and I think they remade it with Lindsay Lohan, but let's not get into that. But in the original Japanese version, it was on demand a few years ago, and I watched it, and somebody said that somebody in there said that being traumatized was something happened to you that you can't forget and like not think about. So like that's one example of like kind of what it is to me because I've thought about that over the years. But it's like something that you really can't let go of because it just kind of shook you to the core and it kind of changes you at your core too. Like and things that you can't let go of that you can't stop being afraid of, even if it's rationally. Flashbacks. Like there's things that you just can't function because you've been so like psychologically impacted by this that you just can't, you know. And for me, it's like this constant feeling of impending doom because like it's not, my mind has been blown with trauma so many times that like I can't help but think that like something horrible is about to happen all the time. So I mean that's what it is for me.
hmm Um, when I think about trauma, I think a lot about, I mean, there's so many different kinds, is the reality. Um, a trauma, when I think about it, is something that can affect you both physically and mentally. And it continues with you because, your body or your mind at some point in the trauma was thinking that you were in some serious danger or some sort of impending doom,
Mm.
like Ash said, and it just kind of follows you. Traumas generally, I mean, as I said, it's a wide range. We can talk about like car accidents, hurricanes, floods, tornadoes, assaults, robberies, rapes, plane crashes, school shootings, fires, abuse, and other catastrophic events and situations. And then, and that includes like long-term abuse. Those are actually multiple traumas. That's not just one trauma. That's multiple traumas. And like me almost dying when I had my nasal surgery when they were taking all the bone out of there. Um, that's a trauma. I can never forget that day, and I cannot forget what it was like. That was a trauma. Um, This workbook gives you kind of how traumas work. There's pre-event factors, which are the things that are happening obviously before it happens. Um, like these can give you a greater chance to develop something like post-traumatic stress disorder, like ineffective coping skills, family instability, family history of antisocial criminal behavior, substance abuse, trouble with authority, absence of support. Um,
Heightened emotional sensitivity.
yep. There's the event factors, which um, these are the factors related to the victim during the event that contribute to the possibility of developing it. Geographic nearness to the event, the level of exposure, the event's meaning to you, how old you were, whether it was once or multiple times, the duration of the trauma, whether the threat is ongoing. Um, and then there's post-event factors, which are the risk factors, um, obviously that happen to make it worse afterwards. No real social support, not being able to do something about what happened, indulging in self-pity while neglecting yourself, being passive rather than active, inability to find meaning in the suffering. Um, so And then we're going to actually talk about three different disorders tonight because PTSD is a really complicated issue. And over the years, the people that are in charge of the DSM, which, gives you all of the information as to all the different disorders and illnesses and all of that all across like human realm, I guess. Um, they had decided a couple of years ago that the term for just the general post traumatic stress disorder was not enough for some of the people that have had PTSD for years and years and years. They needed to go one step further and be like, okay, this is post traumatic stress disorder and this is complex post traumatic stress disorder. But first, we're actually going to talk about acute stress disorder, which is called ASD. Um, and it's you have experienced a traumatic event, and then your response includes intense fear, helplessness, horror. Um, then you have this afterwards you have three or more of the following dissociative symptoms, which dissociative kind of means like disconnected, away from. You feel numb, detached. You have reduced awareness of your surroundings. You were in a daze. You get a sense that the world is unreal, um, which is called derealization. There's also depersonalization, a disoriented perception of your body, identity, or self, which is what people mean when they say like being in two places or like you're looking down at yourself. That would be depersonalization.
It
And
looks like it feels like you're watching a movie of things that are happening to you.
mhm. And then you persistently re-experience the traumatic event in at least one of the following ways. Um, like you avoid stimuli that lead to remembering it. You have marked symptoms of anxiety or increased arousal, problems, sleeping, irritability, poor concentration, increased startle reaction, and bodily restlessness. The condition caused you marked clinically significant distress or impairment. The condition lasted for at least 2 days and at most 4 weeks. So, acute stress disorder is the short term.
The super short
Okay,
term.
so the criteria you just listed isn't necessarily just acute stress disorder. I feel like it's all of them, isn't it? But
Well, all of them have they're kind of they're similar.
okay, because I feel like I've been dealing with all of that stuff you listed for years. So
Well, right, but there's a difference because you don't have acute stress disorder because it's been far longer than a month. You know, the most people with the acute, it's within the first few days and weeks after the traumatic event.
okay,
And it doesn't last as long. Like it's kind of like if you get into a car crash and you're kind of like really antsy and like anxious and whatnot, but in a couple of months
It sort of just wears off
you've
and you get back up on the horse and
you've eventually gotten to a point where every time you open the car door or every time you see this color of the car that you might have hit or something during the crash, it doesn't cause you to go into extreme anxiety anymore. You're just kind of like, oh, okay.
okay, so like that kind of thing, traumatic breakups and stuff, sort of.
Like think of it this way.
Okay.
Um, I have fibromyalgia, which is a chronic pain disorder. Now, if I were having an acute pain problem, what like, you know, shit, ow, I just twisted my ankle. That's acute pain because it's telling me something is wrong right now. You just did something wrong. Or your body is telling you, fix this, it hurts. So acute,
Okay. Yeah, I mean the word acute denotes like smaller angles. So
yeah, it's not
yes.
as severe as the more as like
I
PTSD and severe PT or
complex.
complex PTSD. It lasts a much shorter time, and it's generally something that's easier for somebody to get a hold of and move past.
I
right.
I
I'm just
wouldn't I would just fix one thing about what you said. I wouldn't say that it's not as severe because it can be,
Well, yeah.
but it doesn't last as long.
yeah, it's not as chronic. I'm just like this is I've heard of acute and complex. It's just that this is the first that I'm ever really
Hearing it
learning
for
about it.
this.
Yeah. Okay, so acute is all that, but not chronic. Okay, go on.
Okay. Well, none of us here have acute, so have ASD. So, if any of you watching have ASD and want to comment on it, like definitely go ahead because I can't say that I'm in your head and can understand it. Um, because I definitely have complex PTSD. Now PTSD, post traumatic stress disorder. Let's just talk about the name for a minute because it really tells you a lot. Just looking at the name
Mm,
itself. Post, it's after traumatic, after a traumatic event. Stress, high anxiety, which means you're also probably having problems with like sleep because the higher your anxiety, sometimes like when you get really anxious and whatnot, your body is creating the chemicals that keep you awake because you want to be alert so that you're ready
mm,
for whatever is going to come out of the dark to get you. So that
mm,
contributes to sleeping problems. Um, what they say here, and this was decided, the American Psychiatric Association adapted this description in 1994. So, you have been exposed to a traumatic event in which both of the following are present. You experienced, witnessed, or were confronted with an event or events that involved actual or threatened death or serious injury, or a threat to the physical integrity of yourself and others, and your response involved intense fear, helplessness, or horror, or your perception of the event led to these emotions. then you re-experience the event in one or more of the following ways. So if you only have one, but remember, we got to put it all together. You have recurrent and intrusive distressing recollections of the event, which includes images, thoughts, perceptions. You have recurrent distressing dreams of the event. You act or feel as if the traumatic event was reoccurring, and you may have a sense of reliving the experience through illusions, hallucinations, or active flashbacks, which um, I've done. I have that, and it's weird because it's like you're here, but you're not here
Yeah.
because you go back to that. Like you really feel like you're there again. Um, or you re-experience intense psychological distress or bodily reactions when exposed to internal or external cues that symbolize or resemble an aspect of the traumatic event, such as sights, smells, sounds, dates, and these are what we call triggers.
Thoughts.
Mm-hmm. Yep.
I feel like, yeah, because I think that the things that they list are noise. Because I'm not entirely sure that I've ever felt like I was going to die from anything that traumatized me. I think it was just stuff that just blew my mind so hard that it couldn't be unblown. Like,
Well, which I think probably is what they're talking about when it comes to like the integrity.
mm-hmm.
Things there's not enough brain bleach to clean up.
Can't
Um,
unsee that.
That you just you can't fathom it or something like.
Mm. Just something
it,
that shakes you to the core and just,
I mean, and you hear of an awful lot of soldiers that come, especially wartime veterans, that come back with PTSD. And it's an interesting comparison because people often view Vietnam vets as having a really hard time and being the ones that are kind of down on their luck and awful. And that's not all of them. It seems that there are more recorded events of that, as opposed to say World War II. Um, Emmy, in fact, had mentioned this in how you're treated after the trauma, and there is a huge difference between World War II veterans and the Vietnam veterans. The World War II veterans, when they came back, were heralded as heroes. They were widely praised, and while it doesn't take away the trauma, because of how it was viewed at the time, they probably had a much easier time coping with it. Vietnam vets, when they came back to a slew of people calling them baby killers. Were just really looked down upon for being involved in that. And there were a lot of recorded incidents of Vietnam vets committing suicide, drinking themselves to death, all of that, because the people that coped with them didn't cope with it on a more manageable level. They didn't give them the necessary support that they needed. They just pretty much told them to get over it. And that's sort of part of the problem with treating PTSD, is it really does depend on how the person is treated after the initial trauma.
Yeah, that is a big factor, like your support system and the availability of things such as counseling and um, the different and yes, medications. I know you guys don't like it, but they are a tool,
Well, yeah.
and which is part of the reason why we started Inkblot because we don't we aren't at least in America we're not really dealing with this significant problem. And there's more and more people, men and women, coming back now from these last two wars that are, they really come back with a lot of mixed reactions to what's going on. And they just don't know how to.
They don't really know where else to turn.
Uh-uh.
And if there is one thing that I have noticed about an awful lot of war veterans, they don't tend to talk about it with people outside of the military.
well, they're trained not to.
Yeah, my great grandfather came back from World War II and would not talk about the things that he'd seen there. I mean, he liberated one of the death camps. He liberated Dachau. He refused to talk about anything in there. In fact, the only things that we know about it really are just from what pictures he took.
Well, I think that's similar with other traumas too, because I know
Yeah,
a lot of different people now that I've met through different groups that with other people they don't talk about, like, there's people who have been molested as children like I was, and they don't talk about it with people that have not lived it, especially the men.
yeah,
The
it
men do
seems to
not talk
be.
about it almost at all.
Some do, and we are not at all
Very
saying
few.
that,
Very few.
yeah. But I mean,
There's nothing wrong with that. I mean, well, there's something very wrong with it, but I
Right.
mean that to be a male and to have been sexually abused, especially as a child, it's not your fault, and it's them who should be ashamed, not you.
yeah,
But I do understand where the guys are coming from, and how in that they don't want to talk about their traumas like that with people who have not had similar traumas or do not have similar symptoms, because when you talk to people outside of it about, like this is true of depression, anxiety, PTSD, bipolar, borderline, schizophrenic, all of it. If they don't have the symptoms, they don't get it.
yeah,
Like, you can be supportive, you can try to understand it, but you will never truly get it.
yeah. You will never truly understand what it's like to, be molested. You will never understand what it's like to sit there and watch a child blow away your battle buddy and you have to kill him. There are so many ways that trauma can be brought about. And the unfortunate part is that men and women are conditioned in opposite ways for how to deal with stress through their entire lives. And men are inherently taught by their fathers and conditioned through whatever, just to kind of hold it in and not talk about
Hold it in, don't talk about it, toughen the fuck up. And
Women
then
are the
women,
opposite way.
when
We
we do it,
overreact in a lot of ways.
sometimes, but I would caution the word overreact, because
Well, I
Well,
would
you
say
have
we're more
to.
explosive than implosive. I would say is probably
Right.
more
Well,
accurate.
when you're talking about overreact versus like underreact, you have to like figure out what the baseline is, and I think everybody's perception of the baseline is different. But I think that
yeah,
Yeah,
to women, men appear to underreact, and to men, women appear to overreact.
react.
I mean,
Right.
definitely,
I think that's
for
more what I'm
sure.
trying to say.
right.
And
I got it. Yeah.
conditioned that way
I know.
our entire lives. So it's so tricky to try and reach out to a lot of these people
hmm
when you don't know.
I think
Well,
it's
that's
also one point that should be made is like PTSD is so heavily associated with like war veterans that like sometimes like if I tell somebody I have PTSD, they're just kind of like,
they don't believe you.
well,
Yeah,
you don't
and
look
and
like you've been
that's
in a war. Well, I have. I just didn't actually. I wasn't in the military. I was just in my own war.
Yeah,
We all have one.
exactly. Like, our own traumas become our own wars. Like, we've fought the war to survive physical, sexual, emotional abuse from not just, at least for me, not just one person, but multiple people
hmm
throughout my life that were important to me, and being let down by the people that I was supposed to trust the most.
Yeah.
yeah.
Okay. I think another thing that I've thought about before. I don't know if it's like something that's ever been touched on by anyone else ever. I kind of tend to think of it as like it's a stress disorder. So, I mean, one of the definite kind of things that you deal with having PTSD is like an extremely low tolerance to stress.
Yeah.
Hmm.
Like, I mean, I haven't been able to really hold a job or do school because it takes almost no stress at all to like render me incapable of shit, like, um, like I have as much stress on me as most people do if like they need to go to like they need to like be in full-time school, full-time work, and they have as much stress that I do without either of those.
Mhm.
So like it's like I try to hold a job, and I also have a learning disability as a result of my PTSD because of the stress intolerance. If I get any stress at all, I just it doesn't matter if I'm in a learning setting or not, or in a work setting or whatever. Like if I have any amount of stress on me, I just become completely unable to retain information, and it's really frustrating. It kind of manifests like ADD, but you
Mhm.
can't like drug it away. Well, you can't.
Yeah.
Anyway, like it's a trauma issue, it's a therapy issue,
Mhm.
and it's not going to be until I'm able to address those things that traumatize me, which by the way I have about 17 years of backlog shit that I need to address for me to get over this PTSD. So
Mhm.
it's like I can't, like how am I supposed to go to school and um when I'm trying to train for a job, I'm terrified of authority figures because those are the people that were supposed to be there that didn't. And so, as soon as there's an authority figure, I become too stressed out to retain anything. So, with this current job, I actually am pretty happy with it because one of my best friends is training me and she knows my stuff. So,
Mhm.
it's like she's not an authority figure, she's an understanding, compassionate person, and it's not so hard to learn how to do my job with her training me. But it's like, as soon as like there's a manager that I don't know, I can't deal with it because I have trauma
Yeah.
connected to authority figures watching me learn to do things and yelling at me. So,
And this just goes to show you that PTSD can be so severe that it can make you incapable of work. You
yeah,
can
and
be disabled because of all sorts of different mental reasons.
right. And I mean, the when you were talking about like sleeping earlier, I was thinking about how I have a really hard time sleeping while I'm by myself because I'm just going over those things in my head that just
Hmm.
they've been over for like a decade or more, and it's like I can't, or not even. I've had a lot of significant traumas, but I have like flashbacks, and I can't stop dwelling on stuff, and
Hmm.
uh,
There is let's see. The third part to PTSD is that you persistently avoid things or events, the triggers associated with trauma, and you numb down your response using three or more of the following. You make a great effort to avoid thoughts, feelings, or conversations associated with the trauma, or to avoid activities, places, or people that cause you to remember the trauma. You can't recall an important aspect of the trauma. Your interest or participation in activities is much less. You feel detached or estranged from others. Your ability to feel emotion is restricted, as in your range of emotions, like you are unable to have loving feelings, is the example they gave. You have a sense of a foreshortened future. You can't see ahead into a far off future. Like you do not expect to have a career, marriage, children, or a normal lifespan. Which that one is so me. Like I don't sit there and think about like what it's really gonna be like in old age or whatnot because I'm so like since I was a teenager I was like no I didn't think I was gonna make it past 21. I
no, yeah, I'm
had you told me that I would be alive right now at 26 years old, I would have told you absolutely not. And I would have completely believed it. And do I think that I might make it to 30? I don't know right now. I
no,
really
I'm right
don't.
there with you.
Like,
Like I want to get married and have kids and stuff, but I'm like, I don't know if that's gonna happen.
yeah, like middle-aged life is just so far off to me because I don't feel like it'll ever happen.
Right.
Um, the fourth part is you have persistent symptoms of increased physical arousal that were not present before the trauma, as indicated by two or more of the following: difficulty falling or staying asleep, irritability or outbursts of anger, difficulty concentrating, hypervigilance, which is like being overly watchful, and an exaggerated startle response. You're really jumpy. Or like in certain situations you're extremely jumpy. Like God, if I don't hear my husband coming and he's like right, I scream like full on scream terror. I'm going to die.
Yeah.
Scream.
I noticed fairly recently, like I guess I was kind of aware of it, but if somebody's like sitting next to me and they're a person that talks with their hands or they have like some sudden like moving their arm near me motion, I kind of freak out. I flinch.
Yeah.
Um, and if the whole ball phobia thing that I
Yeah,
talked about before, like I'm afraid of balls because I'm like if they hit my face, like it makes me think of being hit and it scares me.
Yeah, generally, if somebody talks with their hands for me and they're really close, as long as their hands stay below shoulder length,
I
I'm okay. When it gets higher than that, it starts getting into the realm of I feel like I'm about to get hit,
Yeah.
I
and
can't
I don't like it.
I can't handle yelling, like especially men yelling. Like it just like
Yeah.
it can send me into like being completely inactive, curled up in a ball on the couch, like
Mhm.
in the fetal position, going like, nope, not doing this anymore.
Yeah, even if it's like not even related to you that they're yelling.
Yeah.
Like
See,
as
I'm
soon
the
as they start.
opposite. I'm more afraid of quiet anger than I am um or explosive anger. Explosive anger I actually handle far better than implosive anger. The colder angers and the quieter ones, those are what scare me. And those are a big trigger for me. Because generally it means that something's going to come out of freaking nowhere and I'm never going to see it coming.
Mm. You'd prefer to know that it was gonna happen ahead of time.
Yeah. I'd rather just have out with it and, and just not have to be afraid of getting hit because if I get hit, fine, but I'm expecting it at that point. When somebody is just talking in that low, angry voice, they're not yelling, but you can see them getting angrier and angrier.
Hmm.
The next thing I expect is a fist from somewhere,
Yeah.
just waiting for something that may or may not ever come.
Right. I'm afraid of it building into explosive. I guess I'm afraid of both ways, but yeah, mostly I'm afraid of the explosive anger. I'm afraid of any kind of confrontation or disappointing people because,
Hmm.
or even like when I'm with someone and something goes wrong, even if it's not at all directly related to me, like I am used to being blamed and screamed at for like the traffic being bad, you know?
Like
And
I remember oh God, it was years ago. Because Ash and I have been friends for upwards of what
13
12,
years.
13 years now,
Next
and
month,
and
in exactly a month, that will be 13 years that I started at USM anyway.
wow.
Hmm.
So we had gotten into a fight one night. And it was online, like we weren't even on the phone, we weren't in person and whatnot. And I was really, really mad at her. And her boyfriend actually came on because she was reacting so badly to the confrontation that she couldn't handle it, especially from someone that was so important to her. And so I actually finished the argument with the boyfriend,
Yeah.
and then we kind of got over it and moved on. But so that's me saying that like that severe reaction of just not wanting to deal with the confrontation because it's so scary.
No, I start dissociating and stuff, and I can't talk.
Mm. Now with PTSD, the fifth part is that these symptoms have lasted more than 1 month. So acute is telling you that acute stress disorder is a month. Once you get past a month, it's post traumatic stress disorder. And because of these symptoms, you are significantly distressed or impaired in social, occupational, and other important areas of functioning. And then the PTSD is acute if your symptoms have been there less than 3 months, and chronic if your symptoms have lasted 3 months or more. Um, and there is such a thing as delayed onset on PTSD, and that happens if your symptoms don't actually start until 6 months or more after the trauma actually happened. So this is PTSD. And as I said, they decided, I'm trying to figure out what year they decided this, that it wasn't enough to just deal with post-traumatic stress disorder as it is. Um, they needed to start deciding um, how to deal with the rest of it. And what they came up with was complex PTSD, which is also called or is disorders of extreme stress not otherwise specified. And we're gonna hear that not otherwise specified probably a lot as we go through this, because especially when we hit the eating disorders, that term is used a lot. Um, this talks about, like, this is where a lot of the prolonged and repeated and extensive exposure to the traumatic events. They say you may be suffering from a disorder that has actually not yet been named in the DSM-4, uh,
I don't
which
like that.
which is the clinical which is the clinical manual used by treatment providers to determine diagnoses. The DSM-5 is actually going to be set up differently. Um, we will talk about that later, though. Um, so they are actually going to redo how it's set up, but but they call it complex PTSD usually, or I don't know if you're supposed to pronounce that like Desnos, or it's supposed to be DESNOS. I would assume the latter, but I don't know. Um, so the people that they listed that would be sufferers from this are war, prisoners of war, hostages who were held captive for long periods of time, concentration camp survivors, war zone survivors, cult survivors, battering victims, domestic violence survivors, sexual abuse survivors, and children who have suffered years of other types of trauma.
Hmm.
So when we're talking about complex, like anyone who is dealing with PTSD as a result of something that went on for a very long time, like anyone who is has PTSD because of the horrors in their childhood, that's complex or not otherwise specified.
Also, I this isn't really something that's like definitely agreed upon, but it's a theory with the borderline personality disorder that I agree with. That borderline is more or less PTSD that occurs to a extremely emotionally sensitive person. Because the theory that the main woman who researches the BPD stuff, she came up with DBT, the dialectical behavioral therapy.
Hmm.
Her model for the way that BPD manifests is called the biosocial theory. That the way that BPD manifests is a person who has a predisposition to extreme emotional sensitivity experiences a trauma earlier in their life. So to me, that sounds like PTSD. And I think that the symptoms of borderline are pretty well in line with like being extremely sensitive and becoming traumatized and just being in, like if a normal person gets traumatized, it's PTSD, and if like an extremely sensitive person, but you can have both. So I mean, it's really all
Hmm.
up in the air. But that's just a thought that I agree with that I'm just presenting to you, I guess.
That's interesting.
Mm.
I never heard that, but it does kind of make sense with you. And I mean, your early childhood traumas were severe.
Yeah.
So, I think especially once your mom died, that at least for you with BPD, I think that there was kind of almost this no going back. unfortunately,
Mm.
which actually reminds me, I had brought up the myths and everything about mental disorders with the facilitator of my intensive outpatient group, and she said that the way she feels about when it comes to whether people can be cured, um, she says that you would be considered in recovery. It's kind of like how alcoholics are always going to
Recovering
be
alcoholics
recovering alcoholics.
or recovering drug addicts, or
Hmm.
they're always in recovery.
And you can relapse.
Hmm.
Oh yeah.
And I have and I do.
Um, let's see. The other thing I wanted to point out in here, um, they're talking about the complex PTSD. You can come along with these kind of some or all of these personality issues. You have problems with your ability to regulate emotions, especially anger, which that kind of fits me to a T. My sexual therapist that I was seeing, when she had heard all of my stuff, she was like, "So you're one of those people that just, you know, a normal person's emotion is here, and when something happens to you, you're here." And there's nothing you can do about that. You are just feeling it so intensely that you do everything you can to otherwise take yourself out of the problem or knock yourself out and numb yourself. Which is true because I have like I have done in the past. I haven't done it in a really like at least a year, I think. Um Small overdoses of sleeping aids. So like, 6 Tylenol PM. Take that because I want to just knock myself the fuck out. I don't want to be part of this problem anymore. Just put me to sleep. That's something that I do. We find it hard to stay present without becoming amnesic, unable to remember, dissociative, which they parentheses spaced out. I don't know that that's quite the right term for it. Depersonalized or preoccupied with the trauma. You may not see yourself as a functioning individual who can avoid feeling helpless, shameful, guilty, stigmatized, alone, special, or full of self blame. You may not have the ability to separate yourself from your abuser or perpetrator without either being preoccupied with revenge, feeling gratitude, or accepting the perpetrator's introjects as true, which introjects are basically that someone else's belief that you take in to be true, and it becomes your own self thing. Like,
It's kind
so
of like Stockholm Syndrome.
a little bit. It's they
Huh.
specifically said introjects are someone's else's beliefs that you take into your head as your own and then believe. So I like somebody called me um let's go with fat a while ago and whatnot. And it doesn't matter who it was. Like at some point, sometimes you get to a point where like you don't even remember that it was originally their opinion. You just
You just see it as that.
yeah, you just see it as truth and that's it. And it's like, oh, well, I'm fat. And it's like, when people ask you, well, who told you that? And it's a problem because people um it's so easy to hear people make their comments about you, and especially negative ones, and take it to be complete truth than it is to listen to their the positive ones. It's like the negative ones, like you take in and you bury it so deep that it's stuck in there and you can't wash it out. And when somebody says something positive to you, it just bounces off this little shield of negativity. It almost feels like it's like like when people give me compliments, I have a really hard time with that because I never know what to do because I most of the time I don't believe it. So I tend to smile and nod because that's what I've learned to do. And like, I don't want to say thank you because that seems like, I'm getting a full, like, my head is getting big or whatnot about it. And I don't want to come off as that because that's not true. So I try not to say thank you. And I never try to go in the direction of like, yeah, like, I am this or I am that. I just smile and nod because I cannot take, um, positive encouragement. I don't know how to deal with it.
Well, and I mean, they say this for upbringing of children. If you ever call your child a name or you're negative to them, it takes like 20 to 50 good things to overcome the one bad thing. And that's true of adults too. I mean that's true no matter how old you are. You call somebody fat or call them ugly, it's gonna take like 20 times of that same person saying I was wrong, you are you're skinny, you're whatever, before it even starts to make a dent.
Hmm.
You
Um,
can't just take the negative stuff back and expect it not. I mean, expect it really not to affect you. Negative always has more power, I think, because we're all just as judgmental of ourselves. And when people say that, we take it to heart because we see it all the time. We're always more judgmental than we are, praising about ourselves.
Hmm.
yeah. Um, hmm. Interesting.
Um,
I actually have an infographic